It's time for this political assault on the ACA to end. It's time for the repeal votes to end, and it's time for Republicans to admit what the daily deluge of facts tell us, that the Affordable Care Act is working, and in many instances, working better than intended. I don't need to tell you the enrollment numbers. They continue to get better by the day. 8 million people covered in private exchange plans, 6 million people covered through Medicaid expansion, 3 million young people able to stay on their parents' plan. That's over 15 million people in this country who have access to health care, affordable health care that previously didn't. But the news is even better than that. There was a lot of hand-wringing over whether the right people were going to sign up. Well, I come from the insurance state, and the insurance companies themselves are telling us on a regular basis that the pools that are inside these exchanges are as good or better than can be expected. WellPoint, which is the second biggest U.S. healthcare insurer, said this: the average age of enrollment has come down each day in a meaningful fashion. This is their chief executive officer. The risk pool and the product selection seem to be coming along in the manner we had hoped it would. It's very encouraging right now. Other insurers who had stayed out of the exchanges planning to start offering plans in the next round because they see it's good business for them, including United Healthcare, which will be reportedly offering a new plan in the state of Connecticut. CBO continues to show great news on health expenditures as well. The law is going to cost 17% less than was originally envisioned, and overall healthcare spending in the federal treasury is at its lowest rate of increase in the last decade. The data is the data. You are entitled to your own opinion, but you are not entitled to your own facts. And the American people are starting to realize this. Now listen, the polling is not unanimous, but there is a trend line developing. The trend line is that people do not want to see this law repealed. They may want to see it fixed, but they certainly do not support the efforts of House Republicans to repeal this law. We undertook in the Senate about a month and a half ago a new effort at explaining and the Affordable Care Act and pushing back on the Republican mythology that has grown up around it. It's called the Affordable Care Act Works Campaign, the ACA Works Campaign. And we've been successful in bringing Senate Democrats down to the floor, onto social media platforms to really fight fire with fire. Republicans, over the course of the fall and the winter, admittedly, were able to dictate the terms of the debate over the health care bill. No longer. The facts are on our side. The rocky rollout is behind us. And I'm so glad to be joined here today by 4 of my great friends from the House of Representatives who are undertaking a similar effort in the House of Representatives to recruit more members of the House to come down to the floor and tell the true story of implementation, to bring more members onto Facebook and onto Twitter and other social media platform to compete with the Republicans who previously thought that they had a monopoly over that space as well. If we have the courage to tell the real story about what's happening with respect to the implementation of the Affordable Care Act, we will win this day. And as my colleague Chuck Schumer, who couldn't be with us here today, who is normally with us as we talk about the ACA Works campaign, is always there to remind us, an issue that Republicans thought would be the defining issue of the 2014 issue is no longer the kind of vote-moving issue that Republicans thought it would be. This can be an asset, not a liability, for Democrats, given the success that we have seen with enrollment and cost over the past few months. It's just up to us to continue to tell that story. With that, let me introduce my great friend, the chairman of the House Caucus, someone who I worked hand in hand with as we passed this historic law, Xavier Becerra.
Senator Murphy, great to see you back here in the House, back home again, and it's always great to work with you on so many different issues. Also thrilled to be with my colleagues Diana DeGette, Donna Edwards, and Matt Cartwright, who have been championing not just the enrollment of folks, but what we want to get to beyond the enrollment, and that is real health security, where no longer in America does a family say the biggest driver of bankruptcy, personal bankruptcy for American families is that we took our child to go see a doctor or go to a hospital. That's where we are. But let me actually begin in a different way. Let me congratulate my Republican colleagues. It's been a long time since we haven't had a vote on the House of Representatives floor to repeal or dismantle the Affordable Care Act. And guess what? This week, we're not going to have a vote to repeal or dismantle the Affordable Care Act. So I want to congratulate my Republican colleagues for finally moving off of that, at least for now. At least for now. Perhaps they read the news. As Chris said, not just the 8 million plus who enrolled for a new policy under the Affordable Care Act, not just the 4 to 5 million, or perhaps closer to 6 million, who now have health security as a result of being able to access health care through the Medicaid program, or S-CHIP. Not only the 3 million Americans under the age of 26 who have health insurance because of the Affordable Care Act, allowing them to stay on their parents' policy, but on top of that, we're not exactly sure the number yet, but it's in the millions of people who actually have now received health insurance coverage, but not through the exchange itself. They went through an insurance broker or directly to an insurance company. We haven't totaled that up yet. We're getting close to 19, 20 million Americans who would lose if the Republicans keep this fight going on to repeal or dismantle the Affordable Care Act. And so let's put one other thing to pasture right now. People are paying their policies. Once they've signed up, the question was by our Republican colleagues, well, they may have enrolled, but they're not really going to pay the policies. We're now hearing 80 to 90% of those who have enrolled are paying for their policies, many for the first time. I can take you to places in my district where folks had never had an insurance plan in their life. They are now enrolled, and they are paying their policies. That's the good news. And we are now seeing the uninsurance rate for Americans drop to the lowest levels that have been recorded over the last 5 to 6 years. And I have to give you some very good news because it impacts my district and a lot of places throughout the country. In the Latino community, the community with the highest rate of uninsurance in this country with for healthcare, the rate has dropped more than 5% in this short amount of time. This is the first enrollment. This isn't the last enrollment. It's the first enrollment. So maybe it's good that this week Republicans decided not to hold a vote to repeal or dismantle the Affordable Care Act. But let's send a clear message to our colleagues on the Republican side. Our goal wasn't just to have people enroll. Our goal is to secure health care for every family in America. Health security, just like economic security, is what we're fighting for. And that means we want to make sure that this is just a thing of the past when you talk about going bankrupt because of some health care bill, or whether or not you ran into a website that didn't work that well. You've got your health insurance, and we want you to be secure, because the real work that we have in Congress should be a jobs agenda. It should be increasing the minimum wage. It should be providing equal pay for equal work for women. It should be dealing with a lapse for months now of extending emergency unemployment insurance for close to 3 billion Americans who've lost their job through no fault of their own. And it should be getting a vote on the floor of the House right now to fix a broken immigration system when we know the Senate already did its work and we know the votes exist in the House to get it done. So this is all good. And it's even greater that the Republicans aren't trying to dismantle or repeal the Affordable Care Act this week. But we got other big fish to fry, and we need to get to work. We hope our Republican colleagues will join us. With that, let me now yield to a great colleague from the state of Colorado, Diana DeGette.
Thank you so much, Mr. Chairman. Well, I guess it's good news that the Republican majority has not had a vote on the floor of the House this week to repeal the Affordable Care Act, but instead what they decided to do in my committee, the Oversight and Investigation Subcommittee of the House Energy and Commerce Committee, they decided to have a hearing to try to put out deceptive and wrong information about the number of people who have paid their premiums. So they haven't totally abandoned their deceptions. What the Republicans said last week is that they issued a report that said that only 67% of Americans had paid their health care premiums for policies purchased in the state or federal exchanges. Unfortunately, the questionnaire they sent out stopped at April 15th, and more than 3 million people enrolled in policies where their premiums weren't even due till May 1st at the very earliest. And when we had our hearing today and all of the truth came out, what came out is that people enrolling in the health exchanges at the state and federal level are paying their insurance premiums at just about the same rate as everybody else, somewhere between 80 and 90%. So once the data all comes in, I can be guaranteed, I can guarantee you that Americans who have enrolled in these insurance plans will pay their premiums. And the reason is why they signed up for insurance. Americans want to have health insurance. That's why we're seeing record numbers of people. Over 8 million people, 1 million people more than even was predicted before the debacle of the rollout. Almost 5 million people enrolling in Medicaid. People want insurance because they know it will protect the health of their families. In fact, Gallup just released a new poll that found that in the last 6 months, the percentage of adults without insurance has dropped by about 20% in this country, meaning that there are at least more than 11 million Americans with insurance today than there were 6 months ago. Well, what does this mean? It's not just enough to say people should have insurance. The Affordable Care Act made important reforms to improve healthcare delivery and quality, and that's why you have insurance. Just today, for example, Medicare reported that hospital readmissions are falling. Not only is that good news for those patients who are able to be stabilized outside of a hospital setting, it's good news for our budget because we're not paying for those readmissions. And so patients are getting better care. The healthcare system is saving money, and that's real progress. Now, all of us here today agree we need to do more to improve the way our healthcare delivery system works in this country. That's why I've urged my chairman and the chairman of the Energy and Commerce Committee, stop having vote after vote after vote to repeal the Affordable Care Act. Start working together with us across the aisle to make sure that we have the hearings and the revisions necessary to make this law the very, very best law for the health of all Americans. Now I'm very pleased to introduce my colleague, a real leader in this issue, Donna Edwards from the great state of Maryland. Donna?
Well, thank you very much, Diana. And I just have to say the American people, hashtag ACA works, because ACA works, the Affordable Care Act works for the millions of Americans who now have health care delivered to them. It works for 330,000 Marylanders who have health care for the first time. It works for all of those young invincibles who are under age 34 who can get their own health care, or those who can stay on their parents' healthcare plan. Hashtag ACA works because millions of seniors all across our country now are not having to dig into their own pockets because that donut hole is being closed for their prescription drug coverage. I've had seniors who've come up to me, for example, and they've said, you know, this is the first time since I've been retired that I've been able to go and get a preventive health checkup, an annual health checkup, because before the Affordable Care Act, I had to pay for that out of my own pocket, and I couldn't afford it. I've talked to small business owners who've been operating their small businesses part-time while they work full-time to have health care, and they said, you know what, now that I can get health care coverage, I can really jump 100% into running and starting my small business. These are from our small business owners, from our working families, from young people to our seniors who have health care for the first time in this country. And when I go I go out to the grocery store, I was at the grocery store just last week, and a family came up to me and they said, you know what, we've worked many jobs, contract jobs and others, and we've been on and off of health care for many, many years. And there were times that we went without health care, but now I can have health care coverage for my entire family because it's affordable. I don't have to make a choice as to whether I'm going to have my children and my spouse covered, but me not covered for my health care. These are the stories that we're hearing all across the country from the American people because hashtag ACA works. And with that, I'd like to yield to my colleague from Pennsylvania, Matt Cartwright.
Thank you, Representative Edwards. And again, I'm Matthew Cartwright. I represent the 17th Congressional District of Pennsylvania, northeastern Pennsylvania, and half of the Lehigh Valley. I am a freshman here in the Congress, and while I was not here to vote on the passage of the ACA, nor were any of my fellow Democratic freshmen, there are 49 of us, we stand up for the ACA. And I'll tell you why. I come to the Congress with some experience as an employer who saw our payroll deductions for health care, our expenses for health care, taking care of the coverage for our employees go up 10 and 15 and 20 and sometimes 25% in a year. Just ghastly increases in health insurance year after year, and we are absorbing them. I also come here as someone who has served on a hospital board of directors, and seeing that hospitals had to absorb the uninsured care, people who show up in emergency rooms time after time. They come there because they have no insurance to see a family doctor, and so they wait until something festers and becomes worse and worse and becomes a condition that's expensive to treat and may require a hospital admission. As a hospital board of directors, we had to absorb those costs, and you absorb and you absorb and you absorb until you can't absorb anymore. And you can't lay off nurses anymore, and finally you have to close your doors. And I'm here to tell you that in the last 5 years, in my district alone in Pennsylvania, 3 hospitals closed. Now that's a real impact on healthcare delivery. In fact, in the last 5 years, 12 Pennsylvania hospitals had to close. They're not closing because they got tired of delivering healthcare, but they're closing because the money wasn't there to do it. And so I'm here to say I support the ACA. I congratulate the administration on enrolling over 8 million people, despite the software glitches. Let's work together. Let's continue to make it stronger and better, and let's stop wasting American taxpayer dollars with these continual efforts to repeal what I think is a good start. Thank you very much.
Thank you, Matt. Thank you to all of my colleagues. We're happy to take any questions if there are any questions.
Seems as though sometimes when we look at the law, we think of it in 3-year block or just a 1-year block. You know, parts of the website aren't finished yet. We don't know what premiums will look like. On the other hand, you're saying, 8 million enrolled, successful already. How should people look at this law? Should it be more of a long-term 3-year thing or more of a 1-year thing that we're doing now?
Well, I think this law is a short-term success and a long-term home run. And that 8 million number will change even over the course of the year, because anytime someone has a life-changing event, they get divorced or they add a child or they switch jobs, and that describes tens of millions, probably hundreds of millions of Americans, they will then be eligible to sign up. Medicaid in the states that have chosen to open up the law remains open for the rest of the year. So these numbers are not static. They will continue to change. But CBO is still predicting a long-term dramatic expansion in the number of people who are covered. I mean, the numbers you heard today, which you've seen already, are really stunning, that you have seen a 20% drop in the percentage of people who are uninsured in about a 6-month period of time. That is really miraculous, and nobody's saying that that trend is going to continue, but I think you're going to see a long-term chipping away at the uninsured rate, and these exchanges are going to become better run. The technology glitches will completely disappear as time goes on, and I think you can trumpet this as a success. I think it will be a policy and political home run in the long run. Happy to let others.
Yeah, just want to comment on that because I don't think it's an accident that 54% of the new enrollees are women. And part of the reason is because women have been in the uninsured pool of the workforce, that women, especially taking care of children, have faced a circumstance where they can't afford health care. And so I actually look at that trend line as a way of bringing in a vast majority of women who traditionally are in the part of the workforce that has not been insured, and that will continue to grow.
Just one last thought. I think Republicans know that the public approval and acceptance of this law will continue to grow. That's why they have been furiously trying to undermine the act in its infant stages. And that's why today they are reconsidering whether this is still a worthwhile strategy, because they're seeing the public acceptance of this act and public support of the act start to trend upward.
Some of the 52 votes in the House to repeal the law, and there's been several of those that some Democrats have supported, some that many Democrats have supported. The president has even signed a very small handful of those into law. Do you think that's a fair number? I mean, those aren't full repeal, but you're citing them as dismantling.
Yeah, so those, I'll let Javier speak as well. Those are votes to, repeal or substantially amend. And I think that there is certainly room for a conversation about how to make this bill better. And in the Senate, you've got a number of senators, Democratic senators, who are proposing amendments. But Republicans are not sincere about their desire to make the law work better. To the extent that they are proposing amendments to the law, that is part of a strategy to get the camel's nose under the tent. It's time for their strategy to change and for them to realize that we should be working together on implementing it. So I think it is a fair characterization. That's at least my view, because even when they are attempting to change parts of the bill, it is not in an attempt to make the bill better. It's in an attempt to kill the bill in a step-by-step process.
Go ahead.
But what makes this whole thing so fascinating is that for a while there, our Republican colleagues lunged headfirst into this repeal and dismantle mode. Very few of those measures ever went through committee. Very few of those measures ever were coordinated with Democrats to get Democratic support. And I think Democrats on this side have always said, we're ready to do anything to improve or strengthen the Affordable Care Act, because it is a work in progress. Great progress already. It worked fairly well, better than most people expected, including Republicans. But we understand that we have to continue to make it so that it works for everyone very, very well. But remember, it wasn't long ago that Republicans shut down our government over the Affordable Care Act, trying to force us to vote to repeal the Affordable Care Act, and willing to put over 800,000 Americans out of work for a few weeks unless they got their way in changing the Affordable Care Act. So there's no doubt that there's an obsession on the Republican side when it comes to the Affordable Care Act. Whether that diminishes with time, we'll see, because as Senator Murphy has said, they now have to explain why they would want to dismantle or repeal something that is now helping millions of Americans. But there's no doubt that on dozens of occasions, Republicans have done everything in their power here in the House of Representatives to get rid of something that may prevent a family in America from ever going bankrupt simply because they took their son or daughter to the hospital.
I just want to add, as the ranking member on the committee that would have oversight on reviewing what needs to be fixed. Medicare was passed in 1964. We are still working on Medicare to make sure that it works better and better. And I think that we should all change our efforts away from doing things like this hearing today, which was based on deceptive and inaccurate information, and towards working together on a bipartisan basis to build on the successes that we've had and to make the ACA work even better for people.
I would just point out that the overwhelming majority of the measures that have been put forward to make changes to the Affordable Care Act have actually been highly partisan, and so I don't actually think it's a fair characterization to say that measures have come forward and Republicans and Democrats have supported. That's true of a handful of those measures, but they have been overwhelmingly partisan and with not with the idea that we're trying to strengthen or better implement the Affordable Care Act. And if you look at our history, whether it's on the passage of Social Security or as Congresswoman DeGette said on Medicare, that the changes that have been made over that period of time truly have been changes to try to strengthen those laws. And if Republicans would come forward with constructive ways in which to strengthen the ability of Americans to get quality, affordable, and accessible health care, that would be one conversation. But the reality is that has not been the conversation. And frankly, an overwhelming majority of those measures that have been put forward have been to undermine women's health care.
As you've been suggesting, there's been somewhat of a rhetorical shift on the Republican side to talk more about fixing rather than repealing. But what's your level of confidence, particularly in a new Congress where one, if not both, chambers would be run by Republicans, that you could really engage in some good faith fixes and not simply more repeal efforts?
Well, listen, obviously, we don't accept the premise of the question, right? I mean, listen, I think, ultimately Republicans are going to listen to the increasing wave of public opinion towards acceptance of the law and a desire to work on common sense changes. And, you see this robust fight happening within Senate Republicans, for instance, between, a large group of Senate Republicans who believe that, our conversation should be about fixing the law and repeal efforts hurt the party, and those that are still waging war on the law writ large. And that is a conflict that is relatively new to the Republican Party, and I think it reflects the reality of public opinion. So it's an outstanding question as to which wing of the Republican Party ultimately wins this, broader political battle that they are having across the country. But there is, I think, an increasing number of Republicans, I can say certainly in the Senate, who do want to move on to other topics beyond repeal, and who are very open to conversations about how you make the law better. All right. Thank you very much, everybody. Appreciate it. Thank you.
Thank you, guys. Thanks.
Thank you, man.
Okay,
Good to see
thank
you,
you,
man.
Gary.